Okay, hello everybody. I'm Brian, and this is AAMI News and Conversation. I'm here at day 3 of AAMI Exchange in Phoenix, Arizona, and I'm here today with one of our award winners, Millicent Alooh, and we're going to be talking about you won the HTM Leadership Award. But before we dive into that, why don't you introduce yourself? Tell us what you do.
Thank you so much, Brian. So my name is Engineer Millicent Alooh. I come from Kenya, Nairobi, and I'm a biomedical engineer by profession. Yes, I currently work with Nest 360 as a regional director for biomedical engineering. I also work with the AAMEC as the Secretary General for the Association of Engineering of Kenya. And I'm also the co-founder of WIBEC, that is the Women in Biomedical Engineering of Kenya, and AWIBEA, which is the Africa Women in Biomedical Engineering. Thank you.
It's a very long list,
Yeah,
but I think that's kind of highlights the idea that HTM leader here, that's the purpose. And you're leveraging that leadership. We were talking about a little bit before we started rolling to really overcome challenges that you're seeing not just in Kenya but across Africa. So let's touch on that first. What kind of challenges are you seeing for the HTM field for biomedical engineers in Africa specifically?
Yeah, so in Africa, there's quite a number of challenges that we experience in the HTM section. So one of the challenges is that we do not have standards to follow. In different facilities and even different countries do not have standards that govern the HTM across. And so you find that other health sections like the clinical are also developed when it comes to the standards, but the HTM is either very slim, or if it's there, it's never followed because it has never been implemented, or maybe it's just not there totally. So that is number one challenge that makes it really difficult to manage the health technology in Africa. And so you find the biomeds are most of the time left alone to decide on their own. There are no planned preventive maintenance standards. There are no, corrective maintenance standards. We are looking at probably even education in terms of career growth. There are no standards to just advise and even govern the career growth and all that. Apart from the standardization, that is really, really key. The other thing that is there is lack of empowerment of the biomedical engineering staff at the facilities level. So a biomed is expected to maintain all the devices in the facilities. But then you realize that this biomed doesn't have a maintenance workshop to work in or the device repair workshop. And so most of the time you find the biomeds working along the corridors or under the stairways or, within the, wards or something like that.
You probably just saw my jaw drop.
I
It wasn't
saw,
even
I
intentional.
saw.
I was just completely shocked working in. They're on staff and they're not given adequate facilities to get the job done.
Yeah.
Why is that occurring? Is it just, as you said, it's a lack of understanding of what the job entails?
Yeah. So, whenever there's no policy or wherever there's no standards, it becomes really difficult to know what is the best practice. Like the management don't really understand that for you to be an effective biomed, you require tools of work. I usually say this a lot, that when a doctor is employed, the first thing that they are given or they're expected to have is a stethoscope. And you'll see them all walking around with the stethoscopes hanged on their necks. But for a biomed who requires a screwdriver or just a mere tester, there's nothing completely for this biomed to work. So they're thrown in there. They're expected to change a fuse from a top plug, but there's no tool to use. And so that is quite a big challenge in Africa, and that is one of the things that we're really working to see that we come to a solution, we get a solution for the same. The other challenge that I can mention is also lack of capacity building when it comes to on-the-job training or just in-service training.
Oh.
So most of the time we train and we graduate, but post-graduation there are no defined in-service trainings that are available to make the biomates be abreast to the recent technologies, or just to understand what is happening in the current world. So we're left to, rely on the school knowledge and just, you're forever behind. Yeah. So that is also something that is not there. There's no money allocated for the biomates to go for trainings. The doctors will be going for fellowships. They'll be going for, nurses will be having their continuous medical education. But biomates are forever there, not doing anything, not being trained. And so it becomes really difficult for this biomate to even add more knowledge and even, support the facilities in a way that is required.
Now, I'm sure a lot of our viewers are seeing the connection here between these three challenges. It almost all comes back to that there's a lack of sharing of information, because I'm sure if people within their facilities, the health systems, understood what their biomeds need to get the job done better, what the best practices should be, everybody wins. But I'm guessing that's where you come in. That's where your groups are coming in.
Sure.
So what kind of approaches are you taking right now to try to alleviate these problems?
Good question, Brian. So in my capacity as the Regional Director for Biomedical Engineering with NEST 360, we are currently working with different ministries of health to be able to develop the health technology management standards that will be able to support the biomedical engineers in all the facilities, in all the countries where we operate in.
Build that foundation.
Yeah, so we really want the foundation, because even if you do any other thing, but without standardization and without the policies, it's really close to impossible to maintain certain things that we will initiate. So that is number one aim that we are really working on as NEST 360. And the good thing is that we're really having a lot of support from the Ministry of Health, and we're getting a lot of buy-in. But of course, with a lot of pushing and a lot of dedication to ensure that this works, and follow-ups, yeah. The other thing, that approach that I'm taking as a leader, I lead the Association of Biomedical Engineering of Kenya, and I lead the entire biomedical engineering fraternity. And so we have quite a number of seminars and the trainings where we discuss different best practice in biomedical engineering field.
Okay.
And so I use these opportunities to empower biomates to understand their rights, to understand their job, and to make the management also understand what they do. Because if you don't talk, nobody will talk for you.
All right.
And if you're not on the table, again, you will not eat. So yeah, so
I like that.
yeah, so what we do is that we really empower biomates to ensure that they understand. First of all, they need to understand, because they are thrown in an environment where at times you find they think that is the norm. That is the normal, because they have never seen the normal. So that for them is the normal. So in this particular association, that is what we do a lot. And during these particular meetings, we also invite the facility leaders, like the management, to just come and see some of the presentations of what biomates are doing. So with that kind of awareness creation, we are able to capture quite a lot of senior management attention, and we've seen quite a lot of growth and change. The other final thing that I'm doing, I just mentioned earlier in my introduction that I founded Women in Biomedical Engineering in Kenya. I normally call it WIBEC. And I also co-founded African Women in Biomedical Engineering Alliance with two of my colleagues. Why women? It's because where women is, there's a lot of growth. From the Bible days, women reproduce. And so I believe in that reproduction bit in all spheres of life. So when you put a woman somewhere, you can be sure of multiplication. So I formed these groups because women are very passionate of what they do. And I can attest that these groupings are making a lot of change across. They're able to turn men around and tell them, look, this is how we want our workshop to look like. This is how we want our tools to be arranged. This is how we want to manage our documentation. So that's why we formed these particular groupings for women. And the other thing, HTM and biomedical engineering is male-dominated, especially in Africa.
Of course. Yeah, I think 2021, AAMI had done a demographic survey of a lot of different health systems. And the numbers were staggering where we said, oh, wow, this is still a very, very male-dominated field.
Yeah.
And I'm guessing it's no different in Africa.
Oh, yeah, it's quite the same. And so I was looking at offering a shoulder for women to lean on, because majority of them start, register, but then they don't finish. They drop out of school before they finish their biomedical engineering career. But for the few who graduate, they get into the field and then they get discouraged because of the situation at work. The workshops are not there. They're so disorganized. They're so dirty. And I want to be a woman. I drop off my career and probably pursue business or do something else. But for those who even persist and continue in line, they experience a lot of stereotyping from the colleagues. And so these particular women biomedical engineering organizations that are founded are majorly meant to support women and tell them that they are the ones to bring change
Create
in
allies.
HTM field.
I like that.
Yeah.
Very good.
Yeah.
So this is all amazing movements. Is there a way, if say somebody's watching right now and they're based out of Africa, or maybe they just want to help out and help provide some of that guidance, some of that information that you guys need, is there a way to contact or get involved?
Yeah, so we have our LinkedIn pages. So social media pages, so to speak, for all these organizations that I've spoken about. So
and we can provide those links in the description of this video for anybody watching.
Yeah, so the LinkedIn page for AAMI is, of course, still AAMI. Just Google AAMI, you'll be able to get it on the LinkedIn. And then the one for the Association of Medical Engineering of Kenya is still the same name, Association of Medical Engineering of Kenya, and WEBEC, the same. So they use the same names.
Oh, beautiful.
The LinkedIn profile, and even social, and even Facebook pages, yeah.
All right. We'll set up those links for anyone who wants it.
Yeah.
And there was one more story I wanted to talk about with you, because when we were reviewing various applications for the HTM Leadership Award, your nomination included a mention that you had gotten a state commendation for your work during COVID-19. What drove that? What was going on?
Great question, Brian. So during COVID-19, we all understand that we had major oxygen shortage across the globe. And so Kenya wasn't spared. So we were hit badly by oxygen shortage. So one of the things that I did as the leader of biomedical engineering in Kenya, I rallied the biomedical engineers across all the facilities to do something called zero lending of oxygen, whereby we would give our fellow facilities oxygen without adding any cost to it. Normally what happens...
So for those who don't know, in a normal situation, not a world pandemic, if my hospital is having an oxygen canister shortage, I could borrow a canister from you, but you would charge a service fee. Is that correct?
Yeah.
Okay.
Yeah.
And it sounds like in this situation, no fee.
Yeah. So normally I would put a markup because I'm selling for you, and I would sell for you nicely so that I can also make something good out of it. But in this case, we put that aside, the interest and the love for money aside, and we said we were going to put the patients' lives ahead, and we said zero lending for oxygen. If anybody calls you from a facility, a biomed calls a fellow biomed from a facility to lend oxygen, give without asking any question. And then we were religious enough to also return without asking. So we kept lending each other oxygen until the end of pandemic. And the other thing that I also did was really to stand with the government in ensuring that we get oxygen, liquid oxygen tanks that were not there. And So.
That sounds incredibly important, especially during that time where everybody was looking back and saying, yes, breathing is so important during this time period.
Yeah.
Thank you so much for sharing these stories and highlighting all the work that's going on in Kenya and Africa. Is there anything else that you want to mention before we hop off? I want you to get back to the show and enjoy the rest of Exchange.
Yeah, thank you so much, Brian. I think this is my first time coming to AAMI Exchange, and I would say that it's such a great experience. There's quite a lot that is going on here, and there's quite a lot that we can learn from each other, inter-country and regionally. And so it's so exciting to be here, and I'm so glad that I got the HTM Leadership Award 2024. So it makes me really glad and more motivated to keep on doing the work that I'm doing in Africa.
Please do. We're looking
Yeah.
forward to hearing more. And
Yeah.
congratulations once
Thank you
again.
so much.
All right.
Yeah.